Dr. Beck, let's talk knee replacement. We have talked about surgery, the need for surgery, or the unnecessary surgeries, the not need for surgeries a lot, and the whys behind it. Knees seems to be a big problem with men, and almost sometimes, like I talk to some people, almost like a macho thing, you know. Oh, well, you know, I used to be sporty when I was young, and so as you know, and it's almost a macho thing. It tells a little bit about it, you know. Can it be avoided, the surgery I'm talking about? Can we go back to walking normal again, and things like that? And how would you do that?
Well, you know, you may not be able to ultimately avoid knee surgery, but I think the goal would be to prolong your need for the surgery. In other words, can we put this off for 5 to 10 years? Because, you know, a knee replacement only lasts so long, and then you have to have it redone. And so my goal...
How long does it last, by the way? How long, what is a good average?
You know, I'm thinking 15 to 20 years, but I'm not sure exactly. So if you have one too early, you know, if you live to 75 or 80, you're probably going to have it replaced or redone. And that's a major surgery. And the second outcome isn't always as good as the first one. So many orthopedic surgeons tell me they like to wait as long as possible before they put the knee joint in or the hip joint in, because that way they're fairly certain that it's less likely they're going to have to replace that thing in the future.
Okay.
And so what we focus on is, again, trying to help them manage symptoms and help delay the need to get that joint replacement. Very simple things you can do: weight loss. There are certain exercises to help stabilize the knee and strengthen it so it doesn't hurt as much, enables you to do more things that you want to do. A lot of times we look at activity modification. In other words, if running is hurting too much, then let's look at some other activities such as bicycling, which may keep you in good shape, keep your legs good and strong, but not cause you so much pain that you can't sleep at night. So there's different options: anti-inflammatory medications, and then again, there's certain injections you can do into the knee joint, which may help manage your pain and help prolong the need for a knee replacement.
Wow, I've heard that some of those injections which wean you A, off of pain, and B, literally might have a rejuvenating aspect. Basically, the cartilages which are usually gone, they kind of grow back, or at least to a degree grow back. Is that true with some of those injections you guys are doing?
There are certain injections you can do, such as the Synvis, to help kind of replace some of that lost tissue in the knee that helps pad the knee or cushion the knee. And the other types of injections are steroids that help take out the inflammation in the knee joint, particularly if it's really big and swollen and, you know, really inflamed.
Okay. Now, if, you know, let's just say a person comes to you and he was told by the surgeon it's time to cut. And he's, let's say, 50, 55, whatever. Obviously, there's no, like, yes, we 100% can do this, but, like, what is a good time you can now delay that for sure, if not longer, more or less, if at all the whole thing works? You know, because most of those people have the relatively same wear and tear. They, of course, might be at different points, but probably at the point where the surgeon says it's time to cut, they're all at a relatively similar point, I assume. What do I know? I'm not a doctor.
Mm-hmm. Well, it's kind of hard to look in a crystal ball and say exactly how long you can do it.
Sure.
Obviously, you know, you want to give some years to the joint before you have to have it replaced, again, to maximize the chance that the replacement is not going to have to be replaced itself. So I guess I don't have a real magic number for you, but the goal would be to put years onto the knee before you need the knee replacement.
And a question, though, wouldn't it be slightly better for a younger person to get a surgery than an older one?
Well, again, if you put the knee joint in too soon, you're going to have another one put in at some point during your lifetime. And so the idea is to have the joint replaced later rather than sooner.
I see. Because you're probably going to need two of them anyway then if you're still too young. And that really puts you in a high age, kind of.
Yeah,
got
exactly.
It. Okay, got it. Is there ever evidence that perhaps you don't need it at all because you did just fine?
It does happen. People frequently come in and say, I really don't feel like I needed what they were recommending for me, and so some people walk out and don't go back and get a knee replacement.
Yeah, because, their activities maybe slows down anyway as they get older, whatever it may be. You recommending maybe life changes in terms of how they eat, how they walk, maybe even eating in terms of overweight, whatever it may be. And they may comply to it, you know what I mean? They may not anymore jog down the hill because it's nice to jog down, but at the same time, kill their knee. Things like that. And by doing so, all of a sudden actually able to make it through till the end.
Yeah, I find that particularly with activity modification or looking at your sport particularly, you may not be able to continue running past age 60, but you can still do other things. For example, I don't know if you remember Bruce Jenner, the Olympic champion. He was on TV not too long ago, and, he's getting older, and he said, I can't run anymore. I mean, here's an Olympic athlete that can't run, but he said, I can bicycle. So there's always things you can still do, but you have to do them a little bit differently, and I think that's a great point. And people can do quite well just by modifying their activity, but not necessarily stopping activity.
Or the gentleman who just died, I think, a couple months ago, very old, he's the juicer guy. He, vegetable, chocolate lane maybe, or no, maybe, yeah. I mean, 90-some, and he swims, and he pulls boats behind him and stuff like that. So, okay, got it. Well, wonderful. Anyway, avoiding surgery forever and at least super long delayed, because most surgeries have to be eventually redone, and is the key here. Thank you very much, Dr. Beck.